Hello everyone, welcome to Talking Cells, the space where we talk with microorganisms that have marked human history. Today we welcome a virus that has changed medicine, health policies, society, and even the way we talk about diseases. The Human Immunodeficiency Virus, or HIV. Welcome, HIV.
Glad to be here, Dr. Juan. I usually raise a lot of questions, and I think it was time to answer some of them face to face.
Well, let's start with the basics. What kind of virus are you?
Well, I'm a retrovirus. Unlike other viruses, I have RNA as my genetic material, and I use an enzyme called reverse transcriptase to convert into DNA when I infect a cell. Then, that DNA integrates into the host cell's genome, and from there I use it to multiply.
Interesting. And you specifically attack the immune system, is that correct?
Yes, I specialize in invading mainly CD4 cells, which are a type of white blood cell essential for the body's defense. As I destroy them, the person loses protection against other infections.
Okay, the last point seems key to me, because today it's one of the most common causes of death in people with HIV. But let's move on to transmission. How do you infect a person?
Well, I'm transmitted through body fluids such as blood, semen, vaginal fluids, rectal fluids, and breast milk. The main routes are unprotected sexual intercourse, sharing contaminated needles, uncontrolled blood transfusions, though these are rare today, and from mother to child during pregnancy, childbirth, or breastfeeding.
And what about kissing, hugging, saliva?
No, doctor. Even though people stigmatize those things, the truth is that I'm not transmitted through casual contact, not through saliva, hugs, sharing cups, or bathrooms. I'm much more delicate than that.
So once you enter the body, what do you do?
I infect CD4 cells, convert my RNA into DNA, and integrate into cell's nucleus. From there, I make new copies of myself, and in doing so, the cell eventually dies, and little by little, I weaken the immune system.
And that's why you can remain for years without causing symptoms, but still keep progressing if undetected and untreated. But well, let's talk about symptoms now. What does a person feel in different stages of infection?
The acute phase, there may be flu-like symptoms, fever, fatigue, swollen lymph nodes. Then comes a latent phase that can last years without symptoms. But during that time, I keep attacking the immune system.
And if untreated, it progresses to the 8th stage, correct?
Correct. At that point, the body can no longer defend itself from opportunistic infections or cancers, and complications become severe.
That's terrifying. But to avoid this, tell us, how is an HIV infection diagnosed?
There are several ways, Dr. Juan. 4th-generation tests detect antibodies against me and the P24 antigen, one of my proteins that appear in the early stages. These tests can detect infection within 15 to 20 days after exposure.
Interesting. And what happens if a test is positive?
It's confirmed with a second, more specific test. There are also rapid tests with just a drop of blood or saliva that give results in 15 to 30 minutes. They're reliable and accessible.
Let's not forget this, friends. Early detection saves lives. That's why it's important to normalize testing even in people without symptoms. But now, HIV, tell us, what can a person diagnosed today expect?
Well, with access to antiretroviral treatment and good adherence, they can live many years with a good quality of life. The treatment stops me from replicating. This allows the viral load to drop until it becomes undetectable.
That's key because it not only protects the person's health, but also breaks the chain of transmission.
Exactly. When my viral load is undetectable on a sustained basis, I cannot be transmitted sexually. That's called U equal U, or undetectable equals untransmittable. A huge scientific and social breakthrough.
And I understand the treatment must be taken every day without interruptions.
Yeah, discipline makes the difference. I won't go away completely, but if I'm kept under control, I'm no longer a threat.
Now, let's talk about prevention. What tools do we have today?
Well, condoms remain one of the most effective, but there's also PrEP, a preventive medication taken before a possible exposure, and PP, which is used after an accidental exposure if it started within the first 72 hours.
Of course, it's important to clarify that all these methods are safe and effective as long as they're used correctly.
Totally. In addition, regular testing, comprehensive sex education, or reducing the stigma are also forms of prevention.
Now let's bust another myth. Many people still believe that if you have HIV, you can have healthy children.
Dr. Juan, I'm glad you mentioned that because it's false. A person with HIV who is on treatment and has an undetectable viral load can have children without transmitting the virus to them. There are safe medical protocols for pregnancy, childbirth, and breastfeeding. Science has advanced enormously.
Wow, another example of how correct information saves lives and families. But well, HIV, thank you. This is a very clear conversation. There is a lot of story behind you, but also a lot of future thanks to science and information.
Thank you, Dr. Juan, and also thanks to the audience. And remember, I'm not invincible. Knowledge, access to treatment, and empathy are my greatest enemies.
Yes, and also keep in mind that getting tested, staying informed, and treating people with respect is part of the solution. That's all for today on Talking Cells. Until next time.